There is so much to do for Nikki's birthday party. I sure didn't need to be here today. Throws off my whole schedule. I wasn't due to see Dr. Bennett for another 4 months. My heart's doing fine.
This is true.
There's no question about it. I was not happy to be there. I'm in the middle of planning my granddaughter's birthday party, and suddenly I'm back at the doctor's office. Diabetes was just not on my agenda.
Brenda's been through a lot. 2 years ago, a heart attack. A mild one, thank goodness. And now this. You know, I was thinking, she can handle this. I mean, come on, she's a strong woman. I knew she could.
Good morning.
Dr. Bennett.
Brenda.
Good morning.
Michael.
Good morning, sir.
Thank you for coming in this morning. So how are you feeling?
Oh, okay.
Before we get started, Dr. Bennett, I do have one question. Brenda's other doctor, Dr. Shepard, well, he gave her something to take for her diabetes, so why did he want us to come over here?
I thought we had my heart condition under control.
As your cardiologist, I am just as concerned about the diabetes as Dr. Shepard. You see, diabetes affects your body's ability to process the sugar in your blood. That excess sugar can damage your blood vessels.
So that could cause more problems for my heart?
It could. Diabetes raises the risk of another heart attack or a stroke.
Oh, yeah, Dr. Shepard did mention other complications, like blindness.
Well, I'll be honest with you. There are some worst-case scenarios if you ignore diabetes. Blindness, nerve damage, kidney disease. And these are conditions that don't go away. They can really mess up your life. Now, you're managing your heart disease. Let's make sure that's all you have to deal with. I see you've been able to bring down that spike in your blood glucose.
I think at that moment I was thinking, like, not again. Why me? Okay, maybe I was a little afraid, and maybe I was just feeling sorry for myself.
We are going to manage your diabetes as a team. Dr. Shepard's going to help you keep that glucose level under control with testing and medication. I see that he's referred you to a podiatrist for your feet and an ophthalmologist for your vision. You should keep those appointments. Now, you remember Ted, our nurse practitioner. He will help keep an eye on your blood pressure and your cholesterol. That diet and exercise program from rehab, that is twice as important now, Brenda. The team's going to stay on you about that.
I've been taking my meds, and I test my blood every day. At first, I thought it was going to be a problem, but it turns out it's no big deal. Now, losing the weight is a whole nother issue. It's hard working that diet in all the time.
Like what Dr. Bennett said about the team approach. Got me thinking, what can I do? Then I realized Brenda's biggest challenge is food. You know, eating right. And I haven't always been a big help with that. You know, since your heart attack, you have really tried with that diet. I mean, she really has. But baby, then we started slipping back because I kept asking you to cook the foods that I liked. The foods that I was used to. Brenda, I don't want to be part of the problem. I want to be part of this team. Your team.
Wow, that was something. For him to step up like that? So what am I going to do? I hate that I have this whole other thing to deal with. The idea of being disabled, that scares me. I don't want to have to depend on anyone to get me around. I want to be there for our kids, our grandkids, and for Michael. Honey, I appreciate what you said, And I could use some moral support when it comes to the diet. But you never forced me to eat anything. No, this is on me. If I'm going to have a team working with me, then I've got to be the star player. Dr. Bennett, if you don't mind, could we go over this one more time?
Sure. I see a lot of patients who have both heart disease and diabetes. The ones who really thrive do it by making healthy changes in the way they live, and they stick to those changes every day. Brenda's doing great now. Her numbers look good. She's lost 10 pounds. She says it's the power of the walk and talk. Whatever that is, I hope she keeps doing it.
So when Michael and I set our minds to something, we make it happen. We're eating a lot better now, and I can feel the difference. We both seem to have a lot more energy. We used to take these long walk and talks. I love them. So I put them back on the list. Some things you just have to make time for.